What is the best Medicare supplement plan out there? How do I choose the right Medicare supplement plan? Well, in this video, we're going to help you diagnose the two options that are most commonly chosen when it comes to Medicare supplements. So let's get into it. First, let's talk about what Medicare supplements are not. Medicare supplements are not Medicare Advantage. A lot of people out there will refer to a Medicare Advantage plan as a supplemental plan. It is not a supplemental plan. The reason why a Medicare Advantage plan is not a supplement is because it doesn't go along with your original Medicare. It actually replaces your original Medicare. So let's talk about exactly what a supplement is. First, you have to know what original Medicare does. So you've got original Medicare Part A and Part B. Part A is going to be your hospital benefit. This hospital benefit is going to pay for your medical expenses as soon as you are wheeled back from the ER and admitted into the hospital. So think of anything inpatient is going to be related to Part A. That has a deductible that rolls every 60 days. You also have a Part B, which is going to be anything outpatient. So this is your medical. So this is going to be everything from the ER, doctor's visits, specialist visits, getting lab work done, x-rays, getting CT scans. It could be even treatments for major critical conditions or critical illnesses such as cancer, heart attack, and stroke. It could also include any injections. It could also include any type of chemotherapy treatment. That's what Part B does. So why would someone want to not just have a standalone original Medicare plan with a Part D? Well, because original Medicare has no cap. The first time you have a prescription that the company doesn't like, or you get a diagnosis that the company doesn't like, now when you have to go get underwritten, you're no longer going to be eligible for that policy. So let's get into Medicare Plan G and Medicare Supplement Plan N. So first we'll talk about Plan G. Plan G is by far the most popular supplement. And the reason for that is there was a plan called Plan F that paid for all of your medical bills. You didn't have to pay anything, but that went away in January of 2020. And so a lot of people are switching to the Plan G, or the people who are coming on to Medicare are taking Plan G because it's the next best thing. So how does a Plan G work? First, let's talk about networks. One of the most common misconceptions that I see in a Medicare supplement plan is that they think that their provider or that their insurance carrier is tied directly to the network and doctors that they'll be able to see. That is not true. Medicare supplements work off of the original Medicare network. So how do you know if you're in network? If your doctor is going to bill Medicare, then you are in network. And the reason why that is because the original Medicare is going to make the first payment. They're going to get the entire bill from the doctor or the specialist or the hospital. They're going to pay their portion, and then your Medicare supplement is going to pay the rest of it, or their portion. So Plan G is going to cover 100% of your hospitalization or Medicare Part A expenses. And so on your Medicare Part A, what's going to happen is if you were to be wheeled back into the hospital and you were to be admitted into the hospital for, let's just say, 3 days, and let's say the bill was a total of $30,000 for those 3 days, you would pay $0 on a Medicare Supplement Plan G. You also have the benefit of a medical deductible that's going to be covered once you hit it. So $257 is the deductible for 2025. And once you hit $257 for the year, you're going to be covered at 100%. On original Medicare, you would have a coinsurance of 20%. And so what is the Medicare Supplement Plan G doing? It's just simply covering the additional 20% of every single bill that you have for any medical treatments that you get outside of the hospital. And the other thing that most people don't know about a Plan G is that it covers your excess charges. Providers are allowed to charge above what Medicare is going to reimburse them at the doctor's office, the specialist, the imaging center, whatever it is, and a Plan G is going to cover that. The other thing that Plan G will cover is skilled nursing care, and it will also cover overseas or out of the country expenses up to $50,000 in the event of a medical emergency. So to recap a Plan G, you've got all of your hospitalization covered. You'll pay $0 if you're ever admitted into the hospital. And then for any medical expenses, again, that's ER, doctors, specialists, imaging, treatments, chemo, things like that, you have a deductible for 2025 of $257, and then the Plan G is going to pick up the rest. So let's move on to Plan N. Plan N is going to do the same thing on the hospitalization. So if you were to be admitted to the hospital, you would pay $0. The difference in the Plan N is going to be when it comes to your medical treatments or your outpatient treatments, as some would call it. So let's say that you hit your $257 deductible. Now you're going to move to a copayment system. For doctors, specialists, visits like that, you're going to pay $20. For a ER visit, you're going to pay about $50. Here's where Plan N completely differs from Plan G. On a Plan N, you do have to pay those excess charges. So doctors, specialists, people like that are allowed to charge 15% above what Medicare would reimburse. If you're on a Plan N and you get an excess charge, you're going to be responsible for that full amount. Now, that may not seem like a lot on $100, but let's say that you get a surgery from a specialist who is going to do a hip replacement. And let's say that that surgery is $20,000. Well, now you're going to have to pay $3,000 because 15% of the $20,000 bill would be $3,000. And so that's the biggest difference of a Plan N. Yes, it still has coverage overseas or out of the country. And again, the biggest difference there is going to be the copayments. Obviously, an N is going to be more cost effective. So if you're willing to assume the risk of the 15% excess charges, then maybe an N is a plan for you. Also, we tend to see some of our clients who are getting older, maybe on the healthier side, are going to be willing to pay maybe $30, $40, $50, $60, $80 less per month to be on a Plan N, to pay some of those copays, to be willing to take some of the excess charges. And especially if you're in a smaller metro area or a rural area, those hospitals, doctors, specialists, things like that are less likely to charge excess charges. If you're in the big cities, think New York, Chicago, Miami, California, any of those large cities across the United States, you are going to then more than likely have an excess charge when you see a doctor, specialist, or go get some type of surgery done on a Plan N. So on a Plan G, your maximum charge that you would have would be $257 in medical expenses for the year, and then you are covered at 100%. So I hope this was helpful. Just again, to recap some of the misconceptions that we see with a Medicare supplement. No, your network is not tied to your provider, whatever provider that may be, or the carrier that's on the front of your card. Again, the biggest differences between a Plan G and a Plan N are that G is going to cover all of your excess charges and no copays after $257 deductible. And on a Plan N, you would be subject to a 15% excess charge and have your $20, $30, $40, $50 copays seeing the doctor, specialist, or ER visits. But either way that you choose, we do believe that supplements are a great option for people because of the flexibility, because of the amount of exposure that you lessen yourself to. So every single year that you are on a supplement, you know that your out-of-pocket expenses are going to be much lower than they would be on a Medicare Advantage plan. Yes, it does come at a higher premium, but that's all up to you. If you're someone who likes to have a really good health plan or the best health plan, a Medicare supplement is definitely the route to go. In our personal opinion, we believe that Plan G is the best supplement that money can buy. And if you have questions or would like to reach out to an agent today, you can go ahead and give us a call. Reach out to one of our Medicare advisors. We'd be more than happy to choose the right Medicare supplement plan for you.